everybody, we're back again. We're replacing Preston's Omnipod. He's gonna do it himself, and I never told anybody because I forgot. My son is 12 years old, so he's been diagnosed since 2020. I know I've mentioned that in previous videos. Anyways, he's 12 years old, so he's gonna go ahead and set it up for himself, and he's gonna show you how to do it. He's probably not gonna talk, but he's gonna show you. Hi, baby. All right, so we have the Omnipod.
You queen dish.
Yes. All right, all right. So we have all this. Here's the insulin. You okay?
No.
I know.
I'm in pain.
You'll be fine. You got to clean the top of the insulin.
You do?
Yes, I do, with an alcohol swab.
I usually don't do that.
I usually do it every single time.
I don't.
Well, you should. I didn't know you didn't. So he's going to put a little bit of air, because this is a vial and not the pen. He's going to push air into the vial, and then he's going to pull out 150 units.
Last time I did this, the needle came out at me.
That happens.
Is that? Oh.
Now he's checking it for bubbles. Flick it a couple times, babe.
There's not enough insulin.
I know, but flick it so you get all the bubbles out. There you go. We usually get a 3-month supply of insulin from my insurance. He gets Humalog. That's the one that he takes, and he doesn't take a long-acting insulin because of the Omnipod. Whenever you're on an insulin pump, they recommend you do not go on a long-acting, because the short-acting insulin acts as a long-acting, and it continuously gives him insulin throughout the day. And then when he needs to do a carb ratio or anything like that, he go ahead and he adds it into his PDM right there, and then it gives him insulin. And he's getting all the bubbles out.
I'm trying.
Now you're doing a good job, baby.
Every time I do it, I push all the insulin out.
Well, you want me to help you? Because you gotta be careful, because insulin's expensive.
I think it's out. Oh no, it has a little bit more.
Well, let's try to use all of it.
Hey, can you help me?
Yes, I can. All right, I'm going to take this from you. I am going to now get the giant bubble out of this, because you can see in here, there's a big old bubble. Oh my God. There it is. So I'm going to go ahead and get that out. So I'm going to give you to Preston, and he's going to go ahead. Oh, here we go. So insulin. I tap it a little bit, and then I'm going to go ahead and just get it all out. There we go. Now, you got to make sure you get those really big bubbles out, because that's the one that messes it up. So there we go, and now it's coming out perfect. And you see that we are now...
It's clear.
At the 150 mark right here. Oh, maybe you can see it. Maybe you can't. I'm sorry. All right. So now we're going to take his pad. We're going to, here, dip it a little bit like that.
Wait, I'm done. Okay, now
I'm going to go ahead and I'm going to put it into this circle. So it has a thing. I'm going to put it in there. And then I'm going to squeeze all of it in there. and it makes a noise.
And then
Now-
you press next.
Hold on, I will flip this. Go ahead. And then press next. Go ahead, babe.
Then
And now we
you
wait.
Put it next to
Sometimes it takes long, sometimes it doesn't. So I'm going to push pause for a second. All right, so while it's still priming, I'm going to go ahead and clean a spot. So I'm just going to pick a spot on the back of his arm.
it. As soon as you started it, it's done.
Awesome. So I'm just going to clean really good because I don't want him to get an abscess from there being not a clean spot. And that's, by the way, has happened to him a few times.
4 times.
Yeah, he's had to go to the hospital because it's always late at night and he has to get on antibiotics ASAP. All right, so now it says that we are ready to go. So we're going to flip this top off like this, like that. It's going to just come right off. And then I'm going to go ahead and, can you hold this for me?
Oh.
I'm going to, like I showed you guys. So I, like for it to be easier for me, I flip the top part up and then I do this. And then I take this part and it comes right off. Boom. Perfect. Look at that. Boom. Okay. So now I'm going to go ahead. Do you want it up or down?
Down.
All right. So you can do it up or down. Here, hold that for a second. Like that. Okay. Hold that for a second for me, my assistant. Okay, so I'm going to do it down. You can do it up or down on his, on the arm. On the leg, you can kind of just go any direction you want to go. On the back, it has to be either in. Most of the time, it has to be in. But right here, we're doing it upside down. So now, I'm going to go ahead and press start. Go ahead and press it, babe. All right. And then continue. And then I'm going to squeeze, because this one hurts more than the Dexcom, that he says. There you go. Hear the click. And then it's turning pink right there. And you're good. That's it. We're done.
It says,
And then it says, is there a pink, is that part pink? And then you look and you can kind of see, here, lift your arm up for a second. Right here, if my camera would focus, you can see that the cannula, that is what it's called. So you can see the cannula in there, maybe. It's so dark. Anyways, so that's what it's called. It's called a cannula that goes in.
And then you press yes if it's pink.
Awesome. Go ahead and press yes, baby. All right, tell me how you feel.
Painful.
Don't tell people that. People are going to be scared. Tell them how you really feel.
Nice.
Do you prefer having the Omnipod prior to getting shots all the time?
Yes.
Hey, look at when we're talking.
I'm trying to.
I know, but look at me. So you prefer having something that continuously gives you insulin?
Yeah.
Because it's easier. But we know how to count carbs and everything, because when you're first diagnosed, they ask you to not get on any Omnipods just because they want you to calculate the doses just in case the Omnipod breaks or there's nothing, something happens to it or something like that. All right. Thanks everybody for watching. Until next time, have a great day.